The objective is to demonstrate how a department head can use Kodjin Analytics to monitor operational performance, audit complex procedures, and investigate potential health equity issues without needing any technical skills. Dr. James Carter is the head of the gastroenterology department. Dr. Carter is responsible for quality of care, surgical team performance, and ensuring equitable treatment for all patients. He needs to analyze procedural data, but finds traditional reporting tools slow and inflexible. Dr. Carter wants to ensure that complex procedures are being performed efficiently and equitably across different patient demographics. Answering a specific question, like whether procedure times vary for certain patient groups, would typically require a custom report from the analytics team, taking weeks to prepare. Dr. Carter starts with a routine check on his department's key procedure volume. Dr. Carter types, "How many colonoscopy procedures were performed in 2023 by quarter?" The AI assistant immediately understands the business terms colonoscopy procedures, the specific year 2023, and the requested grouping by quarter via the semantic layer. It queries the analytics database and returns the information. Instead of just a single number, the system generates a simple bar chart showing the total number of colonoscopies performed in Q1, Q2, Q3, and Q4 of 2023, allowing Dr. Carter to spot any seasonal trends or variations at a glance. Satisfied with the overall volume, Dr. Carter wants to drill down into a more complex surgical procedure to see who is performing it and where. Dr. Carter types, "Which practitioners performed resection of colon procedures and where were these procedures performed?" Within seconds, the system generates a clear, concise table. It lists the names of the surgeons who performed the procedure, the count for each, and the specific operating room or facility where they took place. This gives Dr. Carter a quick and easy way to view staff caseloads and resource allocation. Now, Dr. Carter wants to investigate a nuanced concern related to both efficiency and health equity. He has a hypothesis that longer than average colonoscopies might occur more frequently in certain demographic groups, and he needs precise data to confirm or deny this. This is a query that would be extremely difficult to build in a traditional BI tool without significant effort. Dr. Carter types, "How many colonoscopy procedures with distribution by gender lasting more than 40 minutes were performed on Asian or Black or African American patients in the last 18 months?" Kodjin Analytics seamlessly handles this incredibly complex conversational query. The AI and semantic layer work together to parse and combine multiple distinct conditions: procedure, duration, patient demographics, time frame, breakdown. The system queries the analytics-ready data, which has been transformed from complex file records to deliver the answer instantly. Dr. Carter observes that the number of prolonged procedures is notably higher for male patients. A static number wouldn't explain why, but the dashboard is dynamic. To investigate the root cause, he clicks directly on the male bar in the chart, the drill-down view. The chart is instantly replaced by a detailed procedure-level table listing the specific 29 procedures that made up that bar. This new view contains crucial context, with columns such as patient name, location name, practitioner name, event code and display, procedure start, procedure end. Scrolling through this granular data, Dr. Carter discovers a pattern. A significant number of these lengthy procedures are linked to a single practitioner and are associated with a specific, complex diagnosis. This insight is far more powerful than the initial number. It suggests a need for targeted peer review or additional training for that specific clinical scenario, rather than a department-wide issue. In just a few moments, Dr. Carter has moved from a 10,000-foot view of his department's workload to a hyper-specific, granular insight about procedural equity. Radical simplicity. He asked an extremely complex question using everyday language and got an immediate, clear answer without writing a single line of code. Beyond static reports, Dr. Carter didn't just get a number. He was able to interact with his data dynamically, drilling down into the results to ask why without typing another question. Speed to insight. What would have involved a lengthy chain of requests to an analytics team, from initial numbers to follow-up reports, was accomplished in a single interactive session. Answers on demand. This process provides an alternative to waiting weeks for a report from the analytics department, allowing for real-time performance audits and investigation. Data-driven leadership. Armed with this data, Dr. Carter can now take meaningful action. He can initiate a targeted chart review to understand why these procedures are longer, assess whether it's related to clinical presentation or other factors, and develop strategies to ensure both efficiency and equitable care for all his patients. This scenario showcases how Kodjin Analytics empowers clinical leaders to become self-sufficient in their data exploration, enabling them to improve patient outcomes and operational excellence directly.